Do you engage in anal intercourse? And if so, are you using a condom? If not, you really should. I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to discuss why condoms matter for anal sex. If you're new here, I share daily content on sexual health, bladder health, and urologic care, plus much more. So if you find this helpful, be sure to subscribe and share the channel. Did you know the FDA has recently approved a condom specifically designed for anal sex? Before this, hundreds of condoms were approved for vaginal intercourse, but none were officially cleared for anal use. But first, why does this even matter? Why do we need condoms for anal intercourse? While pregnancy isn't a concern with anal sex, sexually transmitted infections definitely are. In fact, studies show that people engaging in anal intercourse are about 28 times more likely to contract HIV compared to those having vaginal sex. This is because rectal tissues are delicate, highly vascular, and more permeable, meaning infections can pass through more easily. So yes, protection matters. But how effective are condoms in this case? And why do we need ones specifically labelled for anal use? A survey of 2,000 men who have sex with men found that 69% said they'd be more likely to use condoms if they were marketed or FDA approved specifically for anal intercourse. To study this further, researchers at Emory University in Atlanta recruited around 250 men who have sex with men and 250 men who have sex with women. Participants were randomly assigned 3 types of condoms: fitted, thin, and standard. Each person received 5 of each type, used them, then returned for follow-up visits to receive more. They also used a mobile app to log daily activity, whether they had sex, what type of condom they used, and if there were any issues like breakage or slippage. They also tracked any infections, including STIs or urinary tract infections in partners. Everyone was given water-based lubricant and encouraged to use it during anal sex, while vaginal use was optional. Here's what they found. The failure rate for condoms during anal intercourse was actually lower than during vaginal sex, 0.68% versus 1.89%. One key reason? Lubricant use. About 98.3% of participants used lubricant during anal sex, compared to only 41% during vaginal intercourse. Lack of proper lubrication was linked to higher rates of breakage and slippage. As I've mentioned before, avoid oil-based lubricants with condoms. The best options are water-based, aloe-based, or silicone-based. For anal sex especially, it's important to choose a lubricant with a pH similar to the rectum, which differs from vaginal pH. Silicone-based lubricants tend to last longer and don't dry out as quickly, while water or aloe-based ones may need to be reapplied. Overall, adverse events were very low. Less than 1% experienced STIs, likely due to inconsistent use or breakage. Less than 1% reported urinary tract infections in partners, and fewer than 1% experienced discomfort with condom use. You can use any condom you prefer, whatever feels comfortable and reliable, but I strongly recommend using lubricant alongside it. As always, thank you so much for watching, and remember to take care of yourself, because you're worth it.